Hi guys, welcome to this amazing video. It is the health talk video. We have been talking about health, women, pregnancy, and I know it's helping men outside there. If you're somebody who is aspiring to get married, you can be able to walk the journey of getting a baby together with your wife because you have the information. And if you are there and you're pregnant, congratulations to you, and you're able to walk this journey with information. So today we are still continuing with the journey of the dangers and the complications that may come in this journey of pregnancy. I am getting educated. I have been carrying my notebook. I think this notebook, I am going to save it for my director there, who in future may do something. I also have siblings, yes. So I will give them this information, and we are going to be in a good place. So you should do the same. Let's introduce this new video as we connect with our doctor, Dr. Kibe.
Hi everyone, once again welcome to this episode with Njoki.
Yeah.
And Njoki, let me say you are doing a very good job.
Thank you.
Yes,
Nobody has said that.
Yeah, you are doing a very good job giving us the platform to give this knowledge to people. Yeah. Because most of them we meet when they are sick and when they are, but we don't get this time to talk to them before, so that we can also prevent some things that are preventable.
Wow. Yeah. I'm also very humbled. I could tell my guests that we do not pay these people. They just do it from their heart. Yeah. And that makes me get so much humbled. Because you should have slept. You are in your night shift. But you are here with us.
The grace is sufficient.
Yes, and I know God is going to bless you. So today we are talking about, I'm going to say these terms.
Yes, yes.
But with a lot of grace. Yes, antepartum and postpartum haemorrhage.
Antepartum and postpartum hemorrhage.
I'm doing good.
Yes, you're doing good.
Yeah, so would you give us a definition of what this means?
Okay, so to define these terms, I would really want to divide them into two. Okay. So we have the ante and the post. Of course, that says before and after. Then we have the big word now, the hemorrhage. It just simply means bleeding.
Eh?
Yeah. Yes.
Why did you have to give it a hard name?
So that we can sound to be smart.
Wow. Don't trust.
Yeah. So, but we will start with the antepartum haemorrhage. And this is when a mother experiences bleeding before the baby is born. Any stage of pregnancy, but usually experienced from the 20th week. Okay. But any stage, it can happen even the last stage when the baby is being born, when the mother is in labor, and as early as 20 weeks. Yeah, so we are not supposed to see any bleeding until when the child or the baby is born. Okay. The only blood you're supposed to see is your last monthly period. Okay. From there, the next that you're supposed to see is when you're actually giving birth. Any other bleeding that takes place mid-pregnancy now is called antepartum haemorrhage. Okay. I think now the term is clear. Yeah. And postpartum hemorrhage, it is the blood that now the excess blood immediately after giving birth. Yes, it may be immediate or up to 2 weeks. Okay. Yes, yes.
So in my research, you have really made me to research these things.
It's very important.
2.5% of pregnancies experience this. Yes. What could be the cause of this condition?
We had talked about preeclampsia, and that is a major cause of antepartum haemorrhage. Major because when the blood vessels rupture, or the placenta ruptures, what is called placenta abruption, ruptures, then this blood may come out. But one thing that you're supposed to know is that sometimes there is what we call concealed bleeding, where you are not able to see the blood because it is internal bleeding. So we will depend on the signs and symptoms like dizziness and pain and nausea and paleness and tenderness. Unaona ilesa damu ikijaa hapa, there's that inflammation or you become bulky a little bit, then that one may, now we may do more investigations to rule out the problem. But the other cause is trauma. Like someone may fall or violence. That trauma is another major cause. Some people also have bleeding issues, what we call hemophilia. Now hemophilia also causes, it's a major cause of bleeding. Yeah.
Wow. So how do you assess this condition? How do you investigate about it?
Okay.
Yeah, because there are people who maybe they are just spotting.
Yes.
Yeah.
So when we train women, when they come to the clinic, remember I said this in the education part. We
The
tell them,
antenatals.
the antenatals. We tell them that whenever they see any bleeding, however slight it might be, they should come to us.
Okay.
So for us, we'll be able to know whether it is the cervix that is opening, because that might also be a cause.
Okay.
Yeah. Sometimes we are forced to do a test that is called an investigation we call ultrasound. That one, once we do that ultrasound, it will show exactly where the bleeding is. Sometimes the bleeding is not so much substantial, so we just give you drugs and we give you bed rest. But sometimes the bleeding is too much, so we weigh. When the pregnancy has gone beyond 35 weeks, then we may decide to get the baby out early, because now the baby may choke in the blood.
Okay.
Yes. But when the pregnancy is very early, then we also want to consider, do we save the mother? What is most important, saving the mother or saving the pregnancy?
Wow. So when you're treating it, apart from maybe getting the baby out and bed rest, are there drugs?
Sometimes the bleeding can be caused because of hormonal imbalance, where the body wants to terminate this pregnancy, and therefore you bleed a lot. So we give drugs that are called, in a medical term, we call it tocolizing. This is where you stop the progression of labor so that the bleeding can stop. That is number one. Number two, there are drugs that help to increase clotting or to enhance clotting. Those are the drugs that we also give. Yes. When a mother sees blood, there's also the tendency to be too tense and to have anxiety. Now anxiety goes ahead to complicate the entire issue. Now we also give you drugs that will calm you down, so that you don't really cause more bleeding because of your worrying. Yes. Now, if there is also the part of infections, infections can also cause, we also give antibiotics.
Now let's talk about postpartum.
Yes. So as I had said earlier, postpartum is when immediately after delivery, up to 2 weeks. And this blood can really be as a result of the process of labor, or as a result of lack of some hormones in your system, or as a result of infection. Now immediately after birth, all the blood must come out, and the one who is conducting this delivery must clean all the blood. When there is so much clots remaining inside the uterus, then the uterus does not contract well, meaning that the blood will continue to flow even after delivery to a substantial amount.
Now, for both vaginal and cesarean,
Yes.
there is this blood that comes out after birth.
Yes.
For some, it goes for 1 month.
Yes.
Others, it's 3 weeks. How do you know now this is excessive and this is normal blood level yenye inatoka, so that you can know now this is alarming?
Yes.
ndio not any time you see blood after birth you're like, hey, hemorrhage.
Yes.
Yeah.
Before then, we used to give a specific amount. But these days, we say postpartum hemorrhage is any bleeding that causes effect to the mother. Because if you have a HB of 13 and somebody else has a HB of 5, you see, if one drop for this person who has, we cannot save 10 mLs for you,
Yeah.
and 10 mLs, they are not equal.
Yeah.
So you see, any amount of blood that comes out and affects the mother, then that one is can be classified as postpartum hemorrhage. We also say that you should not have a constant stream of blood immediately after delivery, but a small trickling that continues and not continues up to 8 weeks.
Yeah, but
And
for
the col-
CS, it's usually a lot.
Yes, and also it depends
Yeah.
with one individual to the other, because there are others who after cesarean section they don't bleed much. Actually,
Yeah.
after a week,
Yeah,
they are done. But we say that if you keep on changing your pad and soaking, if your pad is soaking and you see bright red blood and you start feeling dizzy,
Yeah.
you start feeling very thirsty and you pale. If you look at your hands, you're pepper white, then you should raise an alarm.
Okay.
Yes. Now, so that is you were asking
Yeah.
about the causes.
Yeah.
So I said number one is when there is a lot of clots that remain in the uterus, and the uterus does not contract well to stop the bleeding. That is number one.
Yeah.
Number two, we have trauma. During the process of labor, we may have what we call cervical tear. That is when the baby comes out forcefully, causing tear in the uterus.
Yeah.
The uterus is usually highly vascularized, highly supplied with blood vessels. So any tear might cause a lot of bleeding. And not only at the cervix, but we also have what we call, and that one we will talk about it later, what we call uterine rupture. When the uterus ruptures, also there is a lot of bleeding. This may happen antenatally and also postnatally.
Okay.
Yeah. Then we have so we are saying that when there is a tear at the cervix and along the birth canal, any location, or when we have done what we call an episiotomy, when we feel like the birth canal is not sufficient enough to allow the passage of the baby, therefore we give a cut. We may give bilateral, which means both sides, or one cut, one side. If we do not suture it or suture you together properly, then you may also continue to experience this bleeding.
Okay.
Yeah, so those are the major causes. But post-delivery, after 2 weeks, then once you develop an infection, maybe you had a difficult delivery and there was so much, maybe kupima mara mingi, and the infection was introduced and you were not covered with an antibiotic, you may have an infection where the placenta had attached itself, and then that one may also cause bleeding after 2 weeks.
Okay.
Yes.
What is the treatment for this one? Because now there is no baby.
Now the treatment goes case by case. If the issue is blood clots, the treatment is expelling the blood clots. We also give an injection that causes contraction, and that immediately after delivery, for them that have had normal delivery, you realize that there's an injection that you are given. That one is supposed to cause contraction of the uterus. So we give that injection and we make sure that we clear the uterus, and we stimulate, what we call stimulating a contraction. Even after delivery, we need that uterus to really contract to go back to its normal or where it used to be. So the contraction also causes the blood to cease. If it is an issue of tear, we do an inspection. This is what we call speculum investigation. We open you up, we visualize from up there. If we find that there is a tear on the cervix, along the walls, we repair all the tears. And that exercise usually stops all the bleeding because we ligate, or we bind up the blood vessels that are bleeding. After now 2 weeks, when you come, we usually cover you with antibiotics. That is the major treatment. When you come after 2 weeks with that bleeding, we usually do an inspection, and once we do an inspection, mostly we cover the women with antibiotics, and usually it works very well.
And for this antepartum and postpartum,
yes,
does it cause death? Or are there statistics that it does?
Especially immediate postpartum, bleeding is the major cause of maternal death. Once you are not able to control the bleeding, realize that the mother goes down and down and down. So, but our key, that's why there is what we call antenatal care. Antenatal care starts immediately. After delivery, we do a thorough inspection, and you have to be in the hospital. For the first 4 hours, we give you thorough care. And in case we notice anything, we go with speed, because it is so bad. They say that a mother should not die while giving birth or bringing life.
Okay.
Yes.
Now, when they come and you notice that they have the postpartum hemorrhage,
yes,
are there, like, apart from maybe because they have lost a lot of blood,
yes,
do you like give blood from your blood banks, or it's all about taking maybe blood supplements?
Okay. That's a very good question.
You see, there I am knowing these things.
I can see you've done your homework. Yeah. Now, it is very important to know that in the medical field, there is no one fit all or one cut fits all. We do it case by case. Okay. If somebody has lost a substantial amount of blood, and when we check the hemoglobin levels, we realize that you are below 7, then we have to replace or to give you blood products. But when your HB is above 7 and the bleeding has ceased, then we encourage on a proper diet, and also we give you supplements that will enhance blood formation.
Okay.
Yes.
Wow. Thank you so much.
Thank you.
And when I hear postpartum, the only postpartum I knew is postpartum blue, postpartum depression.
Yes.
And I hear hemorrhage as a general word. I have never known that there is anti and post.
Yeah.
So thank you so much for even helping us to dive in, to know more about this. And maybe if somebody has a question, they can tell us. Maybe they have another question about this condition, and maybe we can do a question and answer about this condition of what people have asked.
Sure.
So thank you so much for sacrificing yourself to give us this information.
And thank you so much for having me.
Thank you.
Okay.
So guys, you have heard about the antepartum and postpartum hemorrhage, and hemorrhage is, Daktari has said it's bleeding. It's only that Daktari with, the words. And I know that you have learned something. Share with your friend. And when you like this video, it gives a good message to the YouTube people that we are doing a good job. May the good Lord bless you. This is Shine with Njoki Kamanja Kethi. And remember, you're the light and you can shine.
Shine with Njoki Kamanja Kethi.